Good afternoon, and thank you for joining me today as we update you on COVID-19 here in Erie County. Before we begin, I would like to take a moment to honor every one of our veterans today as we celebrate Veterans Day. Those who have valiantly dedicated their service to our country, to preserve our democracy, to protect the people of the United States of America. To each one of you veterans, we honor you, and happy Veterans Day. Now to COVID-19. We have 99 cases to report as of late last evening, which brings us now to a total of 2,846 cumulative positive cases since March. We have 557 cases that are currently active, certainly the largest number we've ever had active at one time. 2,232 have recovered, and unfortunately 57 deaths have been reported in the NEDS database. Of the cumulative cases in Erie County, 55% are female, 45% male. Regarding race and ethnicity, of our total cumulative cases, 63% are white residents, 14% are African American or Black residents, 8% are Asian, 2% other, and 13% unknown. Regarding Hispanic origin, 5% are Hispanic of any race, 75% are non-Hispanic, and 20% unknown. The breakdown of cumulative cases by age shows that 2% are ages 0 to 4, 1% ages 5 to 9, 8% ages 10 to 18, 16% are ages 19 to 24, 37% are ages 25 to 49, 19% ages 50 to 64, and 16% are ages 65 and older. Between November 2nd and November 8th, we had a total of 381 cases, and that equals 140 cases per 100,000. At this point, 1% approximately of the population of Erie County has contracted the disease. While our cases continue to affect people of every age, race, and gender, and in every area of the county, as you can see on our zone map data, our disease investigators report that the majority of our cases are being traced to adult behavior in the community, basically people gathering. The uptick in cases is definitely concerning, especially with the Thanksgiving holiday approaching, where family and friends will spend hours together eating, laughing, embracing, and celebrating. And it's natural for all of us to feel some sense of COVID-19 fatigue this many months into this pandemic. There are some of us who haven't seen certain loved ones in many months. Some are still waiting to get back to work. Some are tired of the Zoom meetings and virtual schooling and staring at the same faces on a screen at home. Let's face it, every single one of us craves socialization, being near our family and friends. Please take great caution and know any social activity at this point in Erie County is a high-risk behavior. I know that we are all excited and hopeful for what we see potentially on the horizon when they talk about a vaccine, and we should be. But it's important to remember that it will probably be many months before all of us have access to that vaccine. We must not cave into the temptation that could lead to devastating results. We must continue to use the tools that we have at our fingers now to fight this virus. And that includes, of course, we must wear our mask and keep our distance from people who don't live inside our homes. And we must wash our hands frequently. And we must stay home if we're feeling sick in any way. And we must stay away from large gatherings. As Director Lyons said last week, this is not an a la carte menu. All of these things need to be part of your practices to mitigate COVID-19. Our COVID-19 case numbers continue to rise, and every morning when I receive these numbers, it does make me gasp. We do have a mask mandate in place from the state, and we are doing everything we can to keep our businesses up and running. And I continue to say our businesses have done a great job enforcing the mask mandate. But again, we need the help of every single citizen, resident of Erie County. For months, we've been able to keep our numbers lower pretty reasonably because so many people have been using the tools that we have. And we know that they work, but we need to double down now. We need to all come together and use those tools. And I will encourage everyone to download the COVID Alert PA app if you have a smartphone. The app notifies users if they have been exposed to COVID-19 without revealing their identity or their location. Pennsylvanians can use this app when traveling in New York, New Jersey, and Delaware, although it is recommended that you not travel at this time. As much as you can, stay close to home. But the more people that download this app, the more effective the app will be. And it can be found in the Google Play Store and the Apple App Store by searching for COVID Alert PA. As we honor our veterans today, reflect on the many sacrifices that they made for us. Wearing a mask, keeping physically distanced from others, is seen by some as a sacrifice, but it certainly pales in comparison to the many sacrifices made by our veterans and by our current active men and women in our armed services. So honor them today and serve your fellow citizens today and every day by following the COVID-19 mitigation guidelines. And now I am grateful that we have our healthcare partners with us today to share updates from each one of our hospitals in Erie County and their systems. And we'll start with Chris Clark, the President and CEO of Allegheny Health Network, St. Vincent's Hospital. Dr. Clark?
Thank you, County Executive Dahlkemper. Hello, everybody. We are managing fine at AHN St. Vincent. We continue to test patients for COVID disease by physician order at one of two locations, the hospital and the Westside Health and Wellness Pavilion in Mill Creek. At the pavilion, we recently transitioned to an indoor structure in the parking lot that is still separate from the building. The new process was put in place in preparation for the upcoming cold weather months and is very safe for our patients and staff. Like the other health systems in Erie, we partnered with a community center to offer additional testing every week on Thursdays. AHN St. Vincent is proud to work with the MLK Center on Chestnut Street to offer this additional access to testing. To date, we have tested over 8,200 patients with a definite increase in the demand for testing in the recent weeks. Our rate of positivity has now increased to over 6%. And we've had over 60 patients test positive just since last Friday. We have hospitalized over 160 patients to date, and we currently have 20 patients in the hospital with COVID, with one on the ventilator. They are admitted to designated COVID units with negative air pressure rooms and are managed completely separate from our non-COVID patients. By far, patients hospitalized are older and have chronic conditions like diabetes, obesity, lung disease, and heart disease. Specifically, about 75% of hospitalized patients at AHN St. Vincent have been older than the age of 60. A majority of patients are discharged home when their status improves, and about 20% are released to nursing homes. St. Vincent has sadly seen 18 patients pass away from COVID in the hospital since this all started. We offer nationally recognized evidence-based treatments for COVID patients, including the convalescent plasma, dexamethasone, and remdesivir. We continue to allow for only one support person visitor per patient for everybody's safety. And our staff uses masks and shields exclusively. Our PPE supplies are good too. We are also preparing to become a distribution location for the COVID vaccination when it is available and the guidelines are released by the government. As a reminder, please don't forget to get your flu shot this season too. Our team at AHN St. Vincent and all of the frontline staff in the health systems in this community are truly heroes. We are watching the numbers of COVID activity very, very closely, and we maintain a constant state of readiness at AHN St. Vincent. I do want to take this opportunity to reemphasize the importance of everyone's role in preventing the spread of COVID-19, particularly to older patients that are vulnerable and at greatest risk. Please wear a mask to protect them. Avoid congregating in groups, including with the upcoming holidays. Keep your distance from others to more than 6 feet when possible. We really need the community's support so that the health systems in this region can keep up with the demand for all kinds of care, not just for COVID patients. County Executive Dahlkemper, thank you for the opportunity to speak. And I also would like to wish those that have served our country a very happy Veterans Day.
Thank you, Dr. Clark. And now I'd like to invite Emily Shears, the Director of Infection Prevention, Quality Improvement, Regulatory and Accreditation Services at UPMC Hammett, to speak from the UPMC point of view. Thank you.
Thank you. On behalf of Hammett, I would like to say thank you for having us today. As we and our public health colleagues expected, in the past month, cases of COVID-19 have increased across the nation, including the communities UPMC serves. Right here in Erie, UPMC Hammett stands ready and well prepared to care for any and all illnesses, including COVID-19. Over the past months, we have optimized our operations so that we can quickly scale up our ability to handle increased cases of COVID-19. Across our system, COVID-19 patients currently occupy less than 7% of our nearly 6,000 inpatient beds, and we remain fully able to care for all patients with or without COVID. Thankfully, in the recent months, the COVID-19 cases that result in hospitalization have been less severe than they were in the spring and are not resulting in the high rates of ventilators needed, intensive care, or death that we did see previously. Of those patients with COVID-19 who we currently have the privilege of providing care today, none of them are currently requiring a ventilator. As we have seen an increase in our community, we naturally have seen a recent increase in those requiring hospitalization. Our staff are well-trained and highly skilled. Our exceptional teams have been phenomenal at providing safe and compassionate care during this challenging time. We want to encourage the community to continue to seek care when they require it. Our hospital is one of the safest places you can be. We also want to continue to encourage public to practice those public health principles that we know work. So please wear your mask. Your mask protects you as well as it protects others. So wear it properly over your mouth and nose, and do not remove it to talk, cough, or sneeze. Wash your hands frequently, particularly after touching surfaces and your mask. Stay home when you're feeling sick. COVID-19 does have a wide variety of clinical presentations and can be spread easily by people with even the mildest of symptoms. If you have concern that you might have COVID, please call your doctor and get a video visit to determine the next steps for you. If you're experiencing any type of medical emergency, do not delay care. Our UPMC emergency departments are safe and ready to care for you. And practice physical distancing. If you must gather either indoor or outdoors, maintain a safe distance between you and the people that you do not live with, even if you are wearing a mask. In addition to these public health practices, there's something else you can do that's already been mentioned. Please keep yourself healthy by getting your influenza vaccine. This protects you from another common virus that can cause a similar upper respiratory illness as COVID. And then lastly, please keep your routine health visits. These will also help keep you well. So to our entire community, our veterans, when you need care, whether scheduled or emergent, please do not hesitate to come to UPMC Hammett. Our outstanding care teams are ready and our facilities are safe. Thank you and happy Veterans Day.
Thank you, Emily. And now I'd like to have John Gennaro, the CEO Director of Erie's Veterans Medical Center, to speak to us. John?
Thank you, County Executive Dahlkemper. On behalf of our compassionate staff at the Erie VA, I'd like to wish all of our veterans a very happy Veterans Day. To those who have faithfully served and those serving today, you have our deepest gratitude and appreciation. Safe care remains our mission, and we remain vigilant proactively to mitigate the spread of COVID-19. I want to assure our veterans that they can trust and rely on VA care when and where they need it. We offer full services, face-to-face and virtual appointments. And in fact, as we've seen across the medical systems, we've had a 40% increase in the use of virtual appointments. Virtual appointments and care provide a safe and a convenient way to get the services veterans need. Our Erie VA team continues to be proactively engaged in fighting this pandemic. We've taken a regional approach across our integrated hospital system and reviewed trends, cross-level supplies, testing materials, review bed status and patient transfers daily with our sister facilities across PA and within the community. We've built a robust internal capacity for testing across multiple testing platforms with over 3,000 tested to date. We've hired over 50 additional direct care providers to plan for surge and to build redundancies in operations. Weekly, we collaborate and share information, and we're grateful for the great partnerships we have with those community hospitals on the call today. We continue to do surveillance testing our most vulnerable veteran population, the long-term care settings. And I'm proud of our staff members who've answered the call to provide much needed support to other sister VA facilities and state veterans homes at locations across the nation and far away as Hawaii in support of VA's fourth mission of emergency response. Like others have mentioned, I want to remind veterans, if you experience COVID symptoms, please give us a call. First, call our nurse triage line, 814-868-8661. Again, 814-868-8661. This will help limit exposure rather than coming directly into the facility at first. Our nurses will triage and provide the direction and care that you may need. Again, I wish our veterans a very happy Veterans Day and look forward to when we gather for our annual parade and ceremony, which we routinely would host today. And likewise, have those discussions early. I know I have family from out of town, just west of here in Cleveland, and had those discussions this week. And unfortunately, as hard as it may be, to keep people safe, to keep the parents safe, to keep the grandparents safe, we're going to limit any kind of travel and stay home and limit the visitations this year. So please heed that caution and be safe, everyone. Thank you.
Thank you, John. And now I'd like to invite Dr. James Lynn, president of LECOM's Institute for Successful Aging, to speak to us from LECOM. Dr. Lynn?
Good afternoon. Thank you, County Executive Dahlkemper. On behalf of LECOM Health, we want to wish all the veterans a happy Veterans Day. And I'd like to begin by saying that I want to thank all of the LECOM healthcare providers and all the healthcare providers in our community in their dedicated service in this pandemic and this fight. The last 2 weeks have been very challenging times for myself personally. As a geriatrician, I have the responsibility of taking care of at least 20% or more of the post-acute care beds in our community. Our entire health system includes Core Memorial Hospital, Mill Creek Community Hospital, and all the post-acute care beds. We serve 389 nursing home beds. And as such, my colleagues at Hammett and St. Vincent's have given the statistics in acute care and it's similar numbers in our acute care facilities. I'd like to focus my time in speaking about post-acute care, since that's one of the focus in our health system. Currently, as some of you may know, we made the announcement earlier this week that we're opening up a second COVID unit. So the total capacity for LECOM Health is that we have the ability to take care of 70 COVID positive patients that are either being discharged from acute care hospital and or other healthcare facilities that cannot cohort or isolate or quarantine their COVID positive patients. We currently have a total of 47 COVID positive patients in our COVID unit. And these units are dedicated units, and we have converted our units into negative pressure and separate air handling system with separate entrances and exits. And the patients that are COVID negative in these facilities are completely separate away from the COVID positive units. So In that realm, as all of you know, the most vulnerable for this virus is the geriatric patient that is in the post-acute care facility. Many of you know that LECOM Health is taking the position and have created policies and procedures that are more stringent than even the guidelines out there. We're the first health system in the area to stop visitations prior to the CMS mandates. We continue to practice the most stringent policies and procedures to protect our patients and our staff. And just to illustrate to everybody how interconnected we all are and we all have to play a part in this fight, we can make our policy and procedures as stringent as we can. So for example, we have one entrances to every building that we have. Every entrance has a touchless thermal camera to screen patients or visitors or any personnel coming in, employees and patients, temperature every day, and there's a screening questionnaire that they would have to answer. And right now, since Erie County is in the yellow zone, we have instituted full PPE on all of our post-acute care buildings for all the care staff. And despite this, it's very complex because if you imagine that our patients will require outside services and they have to go out to the community. For example, if a patient needs to go out to dialysis, we need to get EMS to come pick them up. So all the personnel, healthcare partners would all have to play a role in this. In addition, when they go out to the community, and there are certain areas that these patients are going to get exposed to. So if we don't do our part, there's a potential that the patient may get exposed outside the community. And when that patient comes back into the building, it is very, very difficult for us to contain sort of the spread if they become positive, but despite all the stringent protocols. So I'm here to urge the community that, as my colleagues previously mentioned, that is very, very important to play your part. You have a social responsibility to our community as well as our seniors. So please wear your mask, wash your hands, social distance, and we'll all get through this together. I appreciate the time. And once again, I thank the veterans for their service and happy Veterans Day. Thank you.
Thank you, Dr. Lin, and thank you to all of our health partners. We are very, very fortunate in Erie County to have so many wonderful healthcare partners, and I know we in county government, particularly the Department of Health, has had a great partnership with all of you throughout this pandemic. And now we're going to turn to the media, and we'll start today with Erie Times News.
Hi, Kathy. It's David. New York State today implemented some more severe limits on gatherings and other things. Has that been a discussion with state officials? Is that something that's being considered for Erie County in light of the increase in cases?
I haven't had any specific discussions. I haven't heard anything specifically that this state is looking at doing, but I'm sure that it is being looked at the State Department of Health and with the Wolf administration as we see numbers increase not only here in Erie County but across the Commonwealth.
And Kathy, based on what you learned from the restrictions when we were in the red zone and the yellow zone earlier on, do you think they would be different in terms of more of an emphasis on gatherings and less of an emphasis on having businesses closed?
Well, we do know that the majority of cases are coming from people who are with people they know, whether that be together in someone's home or in some other setting, and it's very, very difficult to be able to curtail that. That really takes people deciding themselves that they're going to not do those kind of activities. You know, we're not seeing the businesses being a hot spot. Now, people may have done something outside of work, and then they go to work, and then the work has to shut down. The schools have to go virtual, whatever it might be. But the actual virus is not spreading quickly through that business. It's spreading on the outside, really during people's personal time. And I don't know how you ever put enough guidelines in that would stop that. And so it really does take people just deciding that we've got to stop doing all of those things for the time being.
Thank you.
Talk Erie, Joel?
Thank you, County Executive. I actually have a question for Dr. Lin from LECOM. Dr. Lynn, you mentioned that there are 47 in your post-acute care COVID units. The Pennsylvania State dashboard is showing 28 patients hospitalized, one on a ventilator. Can you explain for our listeners the difference of the kind of care that you guys have at LECOM in those COVID units and what's being presented by the acute care that's being reported to the state, and why wouldn't your numbers be reported to the state?
Sure. So for what post-acute care means is that most of our patients, there's two levels of services. One is long-term care, meaning they have chronic diseases with disabilities that they need 24-hour nursing care, and they live there. Those are long-term care residents. And then there's a different population, what we call subacute or transitional patients that are transitioning from acute care hospital that are medically stable enough to go to a post-acute care unit like a skilled nursing facility. However, they're not quite ready to go home. So during these times, the average length of stay for them in those type of beds are somewhere between the neighborhood 17 to 20 days. And some of them may require longer. And the goal is they would require physical therapy, occupational therapy, speech therapy, and nursing to care for them until they're strong enough and safe enough for us to discharge them home, to transition them home or to a community setting. That is the definition of a skilled nursing facility in terms of two levels of services that we provide. So the type of patient that we typically receive are individuals that have spent some time in the ICU and or acute care hospital that are so debilitated that they have difficulty moving around or being discharged to home, or they require more help that the patient may not have the help at home. So we have to help them through that time to get them strong enough and make discharge planning safe before they can go back into the community. As far as your question in regards to reporting and so forth, just so everybody knows, in the skilled nursing facility, there is a mandate that we have to test universally. We have to test all the patients and the residents early on as a CMS mandate. And the rule is that as we test, if there is a positive staff, even if they're asymptomatic, the facilities were required to test on a weekly basis until we have 0 positive employees and patients for 2 weeks in a row before we can sort of step back. But since now the county is in the yellow zone because of the infection rate, all skilled nursing facility and personal care homes in the county would have to test on a weekly basis. And many of you know LECOM is part of the Regional Response Healthcare Collaborative. And part of that is the state's program for us to do post-acute care COVID-19 mitigation. And part of that is when there is a facility that are in need for testing and or there's an outbreak, it is our team that goes out and respond to the facility, what we call a rapid response team. And when that happens, we support the facility with testing. We support the facility with PPE equipment if they do need that. And all those things are reported to the state as well as we test them. It goes into the national database, the NED system that goes to the County Department of Health. So in a way, to pick up the positive patients in the facility and or employees, it is being reported through that system.
Thank you.
Thank you. Jet TV.
Hello. Just a quick question on the hospitalizations, as we're kind of on that right now. Is St. Vincent reported the 20 patients with the one on the ventilator. I'm just curious as to how many the other hospitals currently have right now.
Emily, would you like to speak to that?
Sure. Currently, we have 12 patients admitted with COVID.
Do either
So for Mill Creek Hospital, we have 2 patients admitted with COVID.
And at the VA, we don't have any.
Thank
I'm
you.
sorry, did you say Mill Creek was 2? Kind of broke out a little bit there.
Yes, Mill Creek has 2 COVID and none on ventilators.
Okay, thank you. And then just kind of the other one, Kathy, I guess this one's for you. As for contact tracing, any difficulties with this surge in cases? What are the difficulties with contact tracing right now, if there are any?
There's huge difficulty. I mean, when you think about 99 new cases today, the investigators, who are the individuals who speak directly to the person who's COVID positive to get all the information, make sure that they are isolating and know all the protocol, that's all that anyone's able to do right now. So the contact tracers are working as investigators. Everyone is just trying to contact the positive cases. And then the positive cases are being informed that they should contact their contacts. And we have gotten some help from some of our partners in the state with the Northwest contact tracing effort. But again, nothing like what we've been doing for many months, nothing to the extent as we had been doing, but we're doing all we can do at this point, and that's to contact every single positive case as quickly as we can. I mean, the goal used to be to do it in 12 hours, and it went to 24. Now it's even a little longer, and to let them know that they are positive and they need to contact their contacts. So it's a very serious situation right now. Erie News Now.
Hi, Kathy. It's Elspeth Meisner. What would be the benchmarks that would require us to shut down for a second time? Would it be the amount of cases in a day, the amount of hospitalizations? What things are you looking at when it comes to the possibility of us shutting down?
And I don't know that I really have the answer to that. That's really done on the state level by the governor, his administration, led by the Pennsylvania Department of Health, and that's who had the shutdowns and determined the parameters around that in the spring. Again, I think we've learned a lot about COVID. We've learned what the more risky behaviors are versus the things that maybe aren't as risky. So we've also learned how to treat it a lot better too. But it's still obviously a very contagious virus, and it can still cause people to become very sick, and obviously causes some people to die. So I don't know what the state is going to determine as they see this rise across the Commonwealth, but I know it is likely being discussed. We'll go back to David. Erie
Okay,
Times.
thanks.
Sure, Erie Times News.
Yes, Kathy. We've been dealing with this as a county for more than 8 months now. There's been some troubling times before, but is this week, with the rise in cases and the concern on as we see hospitalizations increase, is this, in your opinion at least, the most troubling time we've seen since the pandemic started, or was it worse when you add the economic impact of when we were shut down early in this late spring, early summer?
It's hard to say. That was obviously very troubling for many, many reasons. But right now I can tell you the morale, the exhaustion that the health department employees are feeling is very troubling for me as I guess as their ultimate boss. So they're overwhelmed. They're trying their best to try to do what they can to help contain and mitigate the spread of this virus. But I've said this all along, the health department can't do it alone. Even with great partners that we have with our health systems and the testing that they've been doing, and obviously the acute care that they've been providing, none of us can do this alone. It really takes every one of us. It takes every citizen of Erie County to decide, this is so serious that I am truly going to change my behaviors and help this community get this under control. So for me, I think this is much more concerning, just as these numbers are so large and the spread is so wide, and it is affecting every area of our county as well as this country. So I think this is probably more concerning to me just in terms of personal health and people's personal well-being.
Thank you.
Mm-hmm. Talk Erie, Joel.
Yes, thank you, County Executive. I have a question for Dr. Clark from AHN. Dr. Clark, can you explain the new CDC guidance regarding mask wearing, talking about now somehow the masks help us, and especially in regards to these surgical masks, how long can you wear a paper mask until it no longer has efficacy?
Okay, so you're certainly referencing, Joel, the fact that when we were first advised to use masks, it was really messaged strongly that it was protecting others in case you were an asymptomatic carrier of COVID. But the fact of the matter is any barrier of any type could potentially help someone from contracting the virus or anything that's airborne. So what time has probably shown, and what you're referring to, is that there's probably some evidence out there. It might not be great evidence, but in theory and conceptually, any kind of barrier with a mask could help, again, prevent someone from spreading it or from catching it. Then with regards to the actual type of mask, and then calling out surgical masks, which is what we use in healthcare, clearly there's an added benefit with using those. Those have been produced in a way to help filter organisms from getting into the nose and mouth area of our healthcare workers. So we advise our staff to use them as long as they can. And you know, certainly there's the ability to change them as frequently as they can or want to. But if they're starting to break, obviously, or get dirty in some way, shape, or form, if they fall on the floor, those kinds of things would lead to reasons why the healthcare worker needs to pick up the next one that they have easy access to.
For the average layperson, though, they shouldn't use the paper mask longer than, 8 hours? And they should be definitely washing their cloth mask every day. Is that accurate?
Washing the cloth mask every day would be ideal. And as far as the paper masks, you could use one in a day. You could easily get it to be used that long, unless it, like I said, breaks or gets dirty. But you could certainly use it for at least a day.
Thank you, sir.
Jet TV.
Is one of the reasons we are seeing so many more positive cases here is because of the tests that are going out? Are there more tests going out than we're seeing before, and that playing a big role in this increase?
I'm going to allow our healthcare partners who do actually do the testing, we don't do the testing in county government, to speak to that. Dr. Clark or Emily Shears, would one of you like to address that?
So Kathy, can you repeat what the question was?
She was wondering how many, the testing versus the number of cases. Are we just testing more, so we're seeing more cases, was the question.
Well, so we are testing more, but our positivity rate is higher too. So we were well below 5%, but the number of tests that are coming back positive has been going up over the last few weeks. So access to testing has been great and better than it's ever been. But clearly we are seeing more tests come back positive. Emily might have something else to add.
Yeah, I would echo Dr. Clark's comments. We do have the ability to test more, but as Dr. Lynn also mentioned, nursing home mandates and testing has also put a large increase on the number of tests being performed. We've performed about 12,000 tests alone, but as Dr. Clark also mentioned, in the past couple of weeks, our symptomatic patients seeking testing has peaked at 18% within that symptomatic population. So definitely more cases and more testing occurring.
Dr. Lynn, would you like to comment on that at all?
Sure. We're experiencing the same thing in the post-acute care world. We're seeing more, we have to do the mandate testing like I mentioned, but the positivity rate for the employees and all of the staff in the 7 counties that the regional health response team goes out, we've been seeing more positive staff as well as patients in the facilities in the last 2 to 3 weeks.
Thank you. Erie News Now.
Hi, Kathy. It's Haley Potter. We actually have a question from one of our viewers. They want to know what the death rate is at each of these hospitals. So if maybe the hospital representatives can answer that question.
Okay, I'll turn it over to them.
Thank you.
Dr. Clark, do you want to start?
Well, I don't have that number available. It's a good question. It is not something that we have calculated, but I will make a general comment without giving the actual number. Death rate from COVID is well recognized to be higher than the death rate from influenza. It's more virulent. It can spread more easily. It certainly has more of an attack on the body, causing an inflammatory reaction. It certainly presents greater risk for our patients. Risk for complications, risk for death is out there.
Did anyone
And
else?
I guess my follow-up comment.
Go ahead.
Whoop.
Go ahead, Emily.
Okay, sorry. My follow-up comment would be, obviously those seeking hospitalization are those with a lot of comorbidities, so they naturally are at higher risk. We have, similarly to AHN, had 16 patients pass away. We've had roughly 150, so around 9% or so of our patients have succumbed to COVID-19.
Thank you.
Thank you.
Sure. Erie News Now?
We just went.
Oh, I'm sorry. That was Erie News Now. I'm sorry. Well, it is getting close to our 45-minute limit that I try to stick with, so I'm going to end with the questions there, and I just want to say one thing about the last question. I was looking at the number of deaths across this country, which are now getting very close to 250,000 people. We have about 270,000 people in Erie County. So if you need to put that in some kind of a context, since March, what's equivalent to pretty close to the population of Erie County has passed away in this nation. That's a lot of people, a lot of death that we have experienced in this country. And every one of those people, I'm sure, was loved by people and is very much missed today. So let's all do our part to try to stop the spread of this disease in Erie County so that we can save lives collectively. I want to talk about the Erie Community Blood Bank because they are in need of your help that helps to save lives. They are seeking potential COVID-19 convalescent plasma donors, CCP they call that, to help increase the area supply of this important treatment. CCP is a plasma donation that also contains the SARS-CoV-2 antibodies within the plasma. Transfusing these antibodies through plasma is one of the approved treatments for patients hospitalized with COVID-19. If you or someone you know has completely recovered from COVID-19, you could be the hero that someone else needs who's critically ill with the virus. So contact the Community Blood Bank about donating your plasma. They're also in need of blood constantly. So patients are in need of the life-saving or life-sustaining blood products, and there's no substitute for blood donations from individuals. All types of blood are urgently needed by the blood bank at this time. Mobile blood bank drives continue to cancel due to businesses and organizations not operating on site or operating in a limited capacity. So, however, the Erie County Community Blood Bank is still open 6 days a week at 2646 Peach Street in Erie. And you can visit 4hearts.org to find a blood drive near you or go directly to the blood bank. The holidays are quickly approaching, and while it will look familiar, very different this year for our families, some families are hoping to be able to have just one more holiday with that loved one, and your donation of blood could give somebody that one more Thanksgiving, that one more Christmas that they so desperately want. Lastly, among everything else that's taking place in our county, I have received reports from the Erie County Office of Drug and Alcohol that there has been a recent increase in opioid overdoses. Something we've been talking about for a number of years, but had somewhat slowed, is now again on the rise. So if you or someone you know is struggling with addiction, please pick up the phone and call 451-6877. That's 451-6877. Help is there for you. Help is available, and they will hopefully help you get through the addiction and the serious consequences of that. So as we close today, as always, I ask you to try to stay as close to home as you can. Reduce your travel. I ask you to wear a mask when you are out away from your home. And I ask you please to stay safe and to stay calm during this pandemic. Thank you.